Now, in the next section, we will talk about the condition known as the gastroesophageal reflux disease or GERD. We will discuss what is gastroesophageal reflux disease and what are the causes why this condition occur and how we can treat this gastroesophageal reflux disease and what are some complications associated with gastroesophageal reflux disease. So gastroesophageal, as the name shows, gastroesophageal, its involvement of the stomach, esophagus. Reflux is the backward flowing or going backward. So in this condition, the food goes back from the stomach into the esophagus and then produce different symptoms associated with gastroesophageal reflux disease. Here you can see there is the reflux of the normally, the sphincter, lower esophageal sphincter, once the food enters from the esophagus to stomach, the sphincter closes and then the food is in the stomach. But if the sphincter is not properly closing and it stays open and relaxed, then some of the food particle from the stomach, they enter back into the esophagus, and then this is known as the gastroesophageal reflux. So it is due to decreased function of lower esophageal sphincter, that is lower esophageal sphincter, thus permitting regurgitation of gastric contents into esophagus. There is regurgitation or backflow of the food particle or content that is present in the stomach into the esophagus. What are some causes of gastroesophageal? It's a common condition. Remember, a lot of patients who come to the OPDs, usually they complain of substernal pain that is due to gastroesophageal reflux disease. So causes pregnancy, any condition that increase the pressure on the stomach and on the lower esophageal sphincter can cause this condition. So pregnancy, especially in the last term, third trimester of pregnancy, when the uterus gets bigger and it puts pressure on the stomach, that pressure causes the regurgitation of food from the stomach into the esophagus, decreases the pressure or lower esophageal sphincter pressure. So one condition is the pregnancy. Then the hiatus hernia is another condition that can cause the gastroesophageal reflux disease. Scleroderma is another. Then we have excessive use of tobacco and alcohol. People who do the smoking, who smoke and who drink alcohol usually can have gastroesophageal reflux disease. Drugs that relax the smooth muscle, like anticholinergic drugs, can cause the gastroesophageal reflux disease. Symptoms: substernal pain, heartburn, and regurgitation. So a lot of people, they complain of chest pain and the heartburn, and sometimes they are worried that they might have angina or chest pain or heart pain. That is because it mimics very closely with the condition. Treatment is by the elevation of head of bed at night. That's very important. Ask the patient to elevate the head, put 2-3 pillows under the head so their head is elevated. That prevents the regurgitation of the food stomach content into esophagus. Avoiding food at least 3 hours before bedtime. That's also important. So the food that is taken should be absorbed or digested before going to bed. Antacids are the drugs that can decrease the production of acid, drugs increasing the tone of lower esophageal sphincter, metoclopramide also can be used. Then anti-reflux surgery, anti-reflux drugs, surgery that can prevent the backward flow can be used, and this is known as Nissen fundoplication. This is the procedure. This is the normal esophagus, stomach, and small intestine. Then after the surgery, that's how the appearance is. Fundoplication. That's the Nissen fundoplication. So very common surgical methods. Drugs for this disorder are very helpful also. Lot of antacids are available, and then we have drugs like metoclopramide that can be effective by lowering the lower esophageal sphincter tone or pressure. So the treatment options, we have quite a few treatment options that are effective. Again, some treatments are H2 receptor antagonist, very, very helpful, like cimetidine and ranitidine. Then we have avoid smoking, and alcohol also can cause this condition. So avoidance of smoking and alcohol can help improve the condition. Avoidance of caffeine and chocolates. Caffeine is also responsible for gastroesophageal reflux disease, so it should be avoided. Less consumption of mints and carbonated drinks. So these are again some treatment options we can try. Some complications of lungs and ear. Lungs, aspiration, pneumonia, asthma, bronchiectasis. So these are some complications associated with gastroesophageal reflux disease, because when the contents of the stomach, they are regurgitated back, they can cause complications like these because of the aspiration. So aspiration pneumonia, asthma, bronchiectasis, otitis media with effusion, there is discharge, pussy discharge from the middle ear, so otitis media. Then we have globus hystericus, that's also the complication. Complications of the larynx, we have posterior laryngitis causing vague pain, hoarseness, especially the regurgitation affects the voice. Hoarseness of the voice is common because of the acidity, and it can cause pain and hoarseness of the voice. Pachydermia laryngeus, contact ulcers and granulomas, posterior glottic stenosis, paroxysmal laryngospasm, and carcinoma of the larynx. So many different complications, not only to that area which is affected, not only to complications associated with esophagus, stomach, which is heartburn, substernal pain, but it can cause the late complications involving the lungs, ear, and also larynx, carcinoma of the larynx, because of constant regurgitation and different food material or different chemicals or acids can reflux back. They can cause these complications like pain, laryngitis, then hoarseness of the voice is common, laryngospasm is common, and then we can even have the carcinoma of the larynx. Some complications now of the esophagus which can occur. We have esophagitis. It can cause inflammation of esophagus, mucosal erosion, burning, damage to the lining of the esophagus. Hemorrhage even can occur. Lot of people, when they have hematemesis or vomiting, they have blood in the so hemorrhage is common. Benign esophageal sphincters can occur, and then the other condition known as Barrett's esophagus. So all these complications are associated with the condition known as gastroesophageal reflux disease, and proper treatment of this condition is important to avoid the complications. Especially these complications of esophagus are very common. It can have stricture, it can have hemorrhage, erosion, mucosal erosion, all these can occur. So that was all about section 3. Thank you for watching sqadia.com.